considering that we are, one way that we could start would be that briefly introduce ourselves, and then after this, and we will introduce briefly the panel, and then each panelist will have a few minutes to present key aspects of their research. And I hope the other participants had the opportunity to watch the presentations in advance. But in any case, after the brief presentation by each panelist, we will open the discussion. So my name is Emanuela Girei. I'm a lecturer in organization studies at the University of Sheffield, and I've been co-convening this study group with Ibrahim since 2011, I think. And yeah, and I'm really glad that you are here and that we have the opportunity to discuss all the interesting research that you have been doing in these last few years. Ibrahim, would you like?
Thank you, Manuela. Just welcoming everyone here, and as Manuela said, my name is Ibrahim Natil. I'm senior lecturer in international relations and diplomacy, and also research fellow at Dublin City University. Actually, I'm looking forward, to listen to your great contributions and your insight, ideas, and experiences from the field. And it's my pleasure to meet you, at least virtually, at this time of the year. You are welcome.
Thank you, Ibrahim. Nimesh, would you like to introduce yourself?
Sure. Thanks, Emmanuel and Ibrahim, and hi, everyone. So my name is Nimesh Tungana. I'm a lecturer in disasters and global health at the University of Manchester's Humanitarian Conflict Response Institute. Originally from Nepal, so I do most of my empirical work there. And today I'm going to be presenting on one of my ongoing projects with a number of colleagues involved. I was hoping to see one or two of them from Nepal, but I think that timing probably didn't work. But anyway, so this is based on my longstanding sort of civil society-led accountability research in Nepal, which part of which I'll be presenting today. Nice to meet you all.
Thank you very much, Nimesh. Melanie, would you like to?
Yeah, very briefly. Hi, I'm Melanie Lombard. I'm a lecturer at the Department of Urban Studies and Planning at the University of Sheffield. The research that we're going to present today is a new collaborative configuration between South African and Colombian cities, although it does build on some long-standing collaborative work between the different kind of members of the team. So I'll leave it there and you'll hear more about it in a moment. Thanks.
Thank you, Melanie. Swati.
Hi, I'm Swati. I have a PhD in public health from London School of Hygiene and Tropical Medicine. From the last 7-8 years, I have been working in an NGO about which I will be presenting in India. It is a women-led NGO which works on the principles of self-help groups.
Thank you very much, Swati. As we are not a large group, maybe also if Carlos Abongil, apologies if I'm not pronouncing your name correctly, and Chara, Evidia, and Adrian would like, Adrian is our helper, with our volunteers. Thank you very much, Adrian, for your support during the panel. Carlos, Vidya, Chara, Abongil, would you like to introduce yourself? And Fiona, apologies.
Hi, my name is Carlos Tovar. I am a professor of the Javeriana Cali in Colombia. I am working in research with Melanie and Fiona about the resilience pandemic. Nice to meet you, everyone.
Thank you very much, Carlos. Vidya, would you like to introduce yourself?
Yeah, definitely. Hi, everyone. Nice to meet you. My name is Vidya Diwakar. I'm a research fellow at the IDS, the Institute of Development Studies. And I work on mainly on poverty dynamics, and it's correlates, drivers of different dynamics, which includes, of course, climate-induced shocks and stressors.
Thank you, Vidya. Thanks a lot. Babun Jail.
Hi, I hope you can hear me.
can.
My camera is not working at the moment. Oh, yeah. Hi, my name is Babon Mile. I'm a master's student at the University of the Western Cape. I'm currently doing my master's in political studies, assisting Prof. Fiona and Melanie Lombard and Carlos Tabar on their research. Yeah.
Thank you very much. Thanks. And Chara.
Hi, sorry, I'm a bit croaky. I'm Kira. I work for a Emerald Publishing. I don't have a particular background in this area, but I published a number of journals that focus on development studies. So I'm just attending to kind of get a bit more of an idea of what research is happening in this area. Apologies, I'm keeping my camera off as my internet connection is a little bit tetchy.
Thank you. And Fiona, apology, Fiona, Carlos, and Melanie, that you could have introduced yourself one after the other, but as you are the research, a research team that we will be presenting together. But thank you, Fiona. Could you?
No problem. So I'm Fiona Anciano. I'm an associate professor in political studies at the University of the Western Cape in Cape Town in South Africa. And I work on informal settlements and civil society issues.
That's perfect. Thank you very much, Fiona. Maybe as you have been introducing yourself, would you like to start? Maybe we can start now with presenting the research, or maybe we can start with Melanie, Carlos, and Fiona, and then Nimesh, and then Swati, if that's fine, and then we open up the discussion.
Okay, that's great, Emanuela. I have the slides, so I will just try and share them briefly. Although my Zoom capacity is not brilliant because I don't use it very often. Can you see them? Okay.
We can. Thank you, Melanie.
It's going to be a collaborative presentation, but I will manage the slides. I'm going to try and put them into presenter mode and see if that will work. Can you still see them in presenter mode? Yeah. Okay, excellent. So I've already introduced myself, so I don't need to do that again. And my co-investigators have introduced themselves as well, Carlos and Fiona. So we are undertaking this year-long project on community-based organisations' pandemic responses, essentially, in Colombia and South Africa, funded by the Urban Studies Foundation. So in our presentation, our longer presentation on the platform, we introduced the project aims, some brief conceptualizations, and some preliminary findings from the two cases. And I'm just going to, well, we're going to very briefly recap those here before we turn to some of the key questions that we want to discuss. We also want to acknowledge here the very important support of the 3 research assistants on the project. So Babongile is with us today, which is great. We also have Lina at the Universidad Javeriana in Cali, and Babongile and Boitumelo Papane are both based at the University of Western Cape in South Africa. So they have been absolutely instrumental so far in the conceptualization of the project and also starting to collect data, and they will continue to work with us over the course of the project. So the project's starting point is the important role that was played by community-based organisations in many low-income neighbourhoods that were hardest hit by not only the pandemic, but also containment measures. And we particularly are interested in how CBOs supported gaps or responding to gaps in basic needs. So our central research question is, how can social infrastructure provided by CBO's pandemic response support wider understandings of or manifestations of community resilience in cities? And we're exploring this through a focus on social infrastructure in different low-income neighbourhoods, which you can see here on the slide, in Cali, Colombia, and Cape Town in South Africa. So what do we mean by social infrastructure? Well, we're using this term to look at situations where, in the absence of key provisions from the state, residents cope with the challenges of life in the city and seek to improve their condition through the development of infrastructure and practices of different sorts. So it's quite a wide term. We find it helpful because it allows us to explore connections between people and things in socio-material relations that sustain urban life. So we're using this lens to explore CBO's responses in these two highly unequal cities to pandemic conditions at the neighbourhood scale. And we're interested particularly in practices around food, care, and digital inclusion. So in this presentation, we look at the first of these dimensions, food. It's well recognised that food security and nutritional status of vulnerable groups deteriorated in the pandemic, may deteriorate further, but also that food has been one of the primary areas for activities around solidarity and grassroots activism. So in the presentation online, we talk about some concepts that are useful. I won't go into detail here. I want to hand over now to first Carlos and then Fiona to briefly present preliminary findings in this area from Cali and Cape Town. So Carlos.
Thank you. The district of Agua Blanca is composed of 4 communes, in which some of the most vulnerable neighborhoods of Cali, Colombia. Its inhabitants assume themselves to be displaced by the Colombian armed conflict, either as displaced persons or as victims. Recently, Agua Blanca was the epicenter of the national strike 2021, an event that articulates the unfulfilled demands of the peace dialogue with the FARC-EP guerrillas and the consequence of social lockdown of the local economy due to the COVID-19 pandemic. According to the social leaders interviewed, their associations assisted in the distribution of food and the optimization of the state resources to provide food security. However, the assistance and strategies were never sufficient, and the solutions were limited to day-to-day. According to the leaders, the organizations don't have the capacity to guarantee food for the population in which they participate. As a result, families send their children back to the rural communities of origin to ensure access to food. Other inhabitants return to ancestral practices to cook more with less, resulting in many neighborhoods improvising tables for food sharing and meal preparation called ollas comunitarias. These strategies to cope with hunger had always been present in Agua Blanca. According to interviewees, the pandemic has had a positive effect because it helped to bring food insecurity in poor neighborhoods. During the pandemic, civil society showed solidarity and supported strategies to face hunger, especially among children. Many people contributed to the purchase of food to be distributed by community-based organizations. These organizations already had networks from previous experiences where food was at risk. Basically, the pandemic served to highlight the vulnerability and hunger in Agua Blanca. Today, with the election of President Gustavo Petro, there are high expectations about how to improve the living condition of low-income people whose food security is in danger and who cannot depend on the goodwill of civil society. The communities expect an articulation between the knowledge of the organization and the resources of the state. Okay.
Thanks. So I'm going to talk about Cape Town. We have 2 case studies that we're looking at in Cape Town, and they're very different. In the recorded uploaded video, I've spoken about an occupation called Reclaim the City, where residents moved into an old hospital building. And there are currently about 1,000 people living there, 350 families, and but that I discussed in recorded. In this brief discussion here, I wanted to reflect on a different kind of organization that's based in informal settlement called Imizamo Yetu. You can see in the picture on the left there, this is essentially an area that is composed of shacks, informal houses, and most of the residents have very precarious work. So when our lockdown hit, and people couldn't leave their homes for 6 weeks, and then actually went on for months and years. It was very profoundly affected. What's interesting about Imozamo-Yetu, though, is it's situated within a very wealthy valley around it. So there's an interesting juxtaposition there of extreme inequality. So one of the organizations in Imozamo-Yetu is called the Sakasizwe Youth Development Program, and it's an after-school program for teens. And we're looking at what this program did pre, during, and after COVID. And it's very interesting because it actually ended up playing, while the program itself has nothing to do with food, it played a very central role in providing food security and to some extent food sovereignty for residents of Imozamo-Yetu. So significant amounts of food, donated food, were distributed and circulated through this organization. As one of the respondents said, it was like Christmas. They had more food, access to food than they'd had previously, ironically. So why is that the case? Partly because of the location. I think there was a strong sense of solidarity in helping people that you could around you. Those who had more could share with those who had less. So obviously that was why location made a difference. But why that organization in particular? So that organization has had years of trust building with parents, with local leaders, because there's a multi-dimensional aspect going on here. It's firstly, who do those who want to donate give the food to? How do they decide who the right people are? And then how do, if the organization like Sakasizwe gets food, how do they know that they're going to engage fairly and equitably within the community and not cause conflict? So this organization was well placed to do both of those things. They had good relationships with funders, but they also had strong embedded social infrastructure with community leaders in the settlement. So that made a difference to the way in which it mediated conflict and was able to actually also process the food. There was also the reality of its physical space. It was based in the middle of the settlement with land around it, so it could actually store food, and had a staff base that were able to come and assist with physical distribution. But that said, there's still some important challenges and questions to reflect on. Firstly, when any NGO or CBO is going to engage in distribution of food during times of crisis, inevitably there are going to be questions of who has the right to access, who has the right to distribution, how are lists drawn up, who decides. And so there comes questions of power, and that's an important issue to look at. Ultimately, Sakasizwe acknowledged that their school families got food first, and that was accepted in the community. But is that a longer term solution? The next issue is about external food supply. Imozamo-Yetu did not have the ability to produce their own food security. They had to rely on external donors. What does that mean in terms of food security? And if we think about future crises, and ask the question then of sustainability. And then obviously it also leads to the question of leadership and trust building, and how one embeds that within communities and how dependent it is on individuals. Thank you.
Thanks, Fiona and Carla. So just to close very briefly, I wanted to highlight some key questions for discussion. So the first is around really what can we learn from practice? What do these empirical examples about food practices tell us about pandemic response and pandemic social infrastructure? Secondly, how do we conceptualize these activities? Are concepts like food security, sovereignty, commoning helpful? Are there other concepts that we could be engaging with? And thirdly, what does comparison offer? So how important are contextual factors, social and material aspects in shaping these responses at different scales, city and national? I'll leave it there. Thank you, Emanuela.
Thank you very much, Fiona, Carlos, and Melanie. And shall we move to Nimesh and then Swati, and then we have a shared discussion. Nimesh, are you ready?
Yeah, sure. Thanks again. So as you probably had a chance to look at our full presentation, so I'm not going to go through all the details, but I'll probably just quickly share some slides just to structure the presentation a little bit. Let's see if I can, where did I? Okay, so for some reason my slide, Okay, never mind. I think I can just talk a little, and so without the slides, so that's okay. So basically, the project that we're working on is looking at the idea of just recovery in the context of pandemic in Nepal. So unlike the previous presentation, it's a single country case study where we're looking at how the pandemic has impacted returning labor migrants in Nepal in the wake of the pandemic, but more importantly, how it has triggered various forms of advocacy and activism to basically counter various forms of injustices faced by the labor migrants themselves. And that includes the organizing by the labor migrants, returning labor migrants, but also civil society, grassroots civil society organization. So that is really the sort of the two questions that we're interested in, looking at the injustices facing labor migrants, but how that has in turn triggered. So it is mostly, we are coming from, I have a background in disaster and critical disaster and development studies. So we are looking at pandemic as a form of a disaster which has triggered various forms of humanitarian suffering, but also opens up various forms of politics of transformation and reforms, including the grassroots level kind of activism led by civil society organizations. And for that, we have Narayan Adhikari, who is actually just joined us now. So he's here, so from joining us from Nepal. So he leads a youth-based organization based in Nepal called Accountability Lab. So in the wake of the pandemic, they've started a campaign called Coronavirus Civic Acts Campaign, which basically sort of organizes around right to information for the labor migrants, but also sort of they have pre-established networks of migrant organizations across Nepal, but also based in different parts of the Middle East who are working on sort of various issues of, firstly, in the wake of the pandemic, on repatriation related issue for labor migrants, but also sort of basically trying to amplify the voices of the migrants in claiming various forms of entitlement that were promised by the state. So this project is basically, we are in a very early stage because we started this just back in January, and it is a very much a participatory and collaborative project. So in Nepal, we have Narayan and Kripa Basnet, who also works for the International Labour Organization there. And in the UK, it's me and Flora Cornish, who's based at the London School of Economics. But we also have a bunch of other local researchers working on this. So it is basically, we are drawing on interview data with the returning migrants, but also with civil society organizations based in Nepal. We are also doing ethnographic field work, mostly looking at public hearings, town hall meetings that are organized by and facilitated by Accountability Lab and other partner organizations. So really looking at what happens in those spaces, those participatory spaces, and the interaction between the migrants and the authorities. It also has an action learning component. So we are also meeting on a regular basis to reflect on the activism and action of Accountability Lab and other partner organizations to really to look at the problem, but also explore some alternatives, right? Some actionable alternatives, more evidence-based alternatives to improve the advocacy and activism. So it's in a very early stage. I put out some thoughts about what we are seeing. So from this activism. So there are a number of different ways in which civil society organizations are organizing around the theme of care for labor migrants, returning labor migrants, so providing various forms of mutual aid initiatives, as previous presenters also presented. They're also collaborating with local authorities in various issues, including organizing public hearings in the interest of returning labor migrants. But in some cases, they are also confronting, like, so they are also, we are saying that it is a mix of care, collaboration, but also confronting the authorities, really sort of around the right to information and other issues. So this is sort of like we, in the hope, we're trying to advance this research forward. It's really looking at disaster as a site of political possibility. So that is our key theoretical framework that we are looking at. And so the question for the organizers and panelists is really, how can we, as scholars, but also activists and practitioners, we can think about sort of sustaining. I think this is the point that the previous presenter also raised about maintaining and sustaining this kind of effort, which has much more grassroots and local focus, but also how they can be sustained and pushed to kind of bring in much more structural and policy reforms. So I'll end then maybe kind of just, I know you already, we want to me to sort of keep it short, but maybe Naren had some final comment to make, and we look forward to the feedback from the audience.
I don't think we have enough time, but I'm happy to respond if there's any question. But just to echo on what you just said, Nimesh, it's, really looking through this project, we're looking for, the political possibilities through disasters. And one of the reasons why it is the large number of the migrant workers, they are working abroad, have no voting rights. So, which, it's something that, maybe we're not directly looking into voting rights, but, it's really something that we want to bring the migrants' voice into a place where, the political decisions, might influence. Other than that, I fully echo what just Nimesh mentioned, but I'm happy to respond if there's any question. Thank you.
Thank you very much, Nimesh and Ayan. And Swati, if you could concentrate your intervention, your presentation in a few minutes, so we have some time for some discussion. Thank you.
Hi. Thank you, Manuela. I have already shared the presentation, so I'll just quickly go over what we're working on. We are a women-led SAG organization working in poorest parts of rural Uttar Pradesh, India. This pandemic saw a great deal of rural poverty. This resulted in loss of incomes, loss of jobs, especially in the urban sector. We saw large-scale migration of men who were employed in the informal urban sector to rural India, and this led to food insecurity. And of course, pandemic had one of the worst impacts in rural India, a large amount of it which was undocumented. In this, the SAG, we saw that emerged as a sort of a safety net, resilient structure for the poor. It really helped in 4 broad areas. One is the health, of course, and this was through providing continuum care for maternal child health or for diseases, even for pandemic, helping in first testing, and when the vaccine became available, helping rural women and rural the marginalized populations get access to vaccination, testing protocols, safety, hygiene, hand washing, getting a whole, making food banks and other forms of grain banks to help poor really take care of themselves during the pandemic. The second is the pandemic really provided a sort of social solidarity networks during the pandemic when incidentally social isolation was acute. There was a lot of emphasis on staying at home, unfortunately not possible in a community-led development initiatives and rural areas where people depend on each other to a very large extent. So safe ways to do that was facilitated by the SAGs. And lastly, I think most importantly, they helped in bringing on linkages with formal institutions wherever possible, letting the people access their rights and entitlements in form of food, ration cards, education, able to get services from the hospital, able to demand accountability. And so because in the pandemic, these areas especially became very neglected and especially apathetic towards the poor rural population. So in a way, that way the SAG really helped cushion some of the impact of pandemic, especially the rural health workers, who really form the backbone of rural health infrastructure during this time. My questions really are related to, as the other presenters mentioned, about sustaining, especially with cuts in funding post-COVID. And this has been a big blow to the NGOs because it was to a very large extent reliant on funding from international organizations as well as big donors, and that has really dried up after COVID. Secondly, my major question is that while the SHG networks have proven to be very useful in a rural setting, because of community ties, because of people not being so mobile, we have not been able to replicate same success in an urban setting, especially with migrant populations. And these are also some of the poorest urban populations with small children, often dealing with addiction, extreme mobility, working in informal sectors, and how to replicate this community-based model in an urban setting is something that I would really appreciate inputs on. So this is, I think I will wind up so that we can have a larger discussion. Thank you so much. Thank you.
Thank you very much, Swati. Thanks a lot. Is there any, there are so many different inputs, and unfortunately we have just 10 minutes. Is there, and we already have a few questions from the presenters, and I'm asking all of you, is there a question we would like to start with? And I'm looking especially at, okay, Bombilek and Nayan that have been involved already in the two different research, but also Vidya, Chiara, Theo. Is there any question from you to any of the presenters or to all of them?
I had a question.
Thank you, Chiara.
And I think Nimesh mentioned this kind of the different approaches to interacting between the community-based organizations and local governments and local authorities is kind of two different approaches of either collaboration or confronting. So I guess I was interested to hear from across different panels if they had any idea of, is there an ideal balance for these approaches, or is it varying from place to place, locality to locality?
Thank you, Chiara. Would the other presenter would like to answer, Chiara?
I guess, I mean, it was not particularly, but that's a really interesting observation, Chiara. So maybe I can add a little bit, maybe clarify what we mean by that. So it's really what we're trying to say with that. It's kind of not just one form of advocacy strategy. It's just heterogeneous various forms of strategy that grassroots civil society organizations have to adapt to the situation. And I think the idea is the collaboration is really you just need to find your target, basically, like who you want to advocate against, basically, right? So in many cases, the civil society organizations, they think like the local representatives, local authorities as their ally, so working closely with the local authorities, whereas the central authorities are where the gap exists, where and because of the kind of lack of policies or policies that are not in favor of, in this case, labor migrants. So it is really sort of balancing that act of who you collaborate with, who you find as ally within the state structures and government structures and bureaucracy, but who you think as, and I think it's also from my field of disaster research, which is also very important too, because as we know, disaster disproportionately impact certain communities. In this case, we are looking at labor migrants, but it's also, as some scholars call, the disaster is a collective stress situation. Even the authorities and state administrators, they are affected by this. So there is also need for the activists and advocates to exercise some kind of consideration, compassion, care, in which how you conceptualize, imagine, enact activism, right? Because it's it's a collective stress, collective suffering situation. So I think that's also where the idea of collaboration comes in. In some cases, the confrontation had to be sort of replaced by collaboration. Does that make sense?
Just to add what Nimesh mentioned about confrontation, it's not really about banging each other's head, rather supporting government with the evidence and data they need to make the effective decisions, but at the same time ensuring that the authority has mechanism and process in place to really recognize these voices in decision making, and to creating that environment where the both parties can sit, talk, have conversation, and follow this iteration process on how to solve the local problem then and there. And it's really about confronting, but with the positive narratives, and working with the positive deviants and the champions within the authority.
Thank you very much, Nayan. And Fiona, would you like to intervene?
I just wanted to make an observation, because I think around the idea of disaster. So we've been doing this research looking at the pandemic, but I've also done research looking at fires that have caused disasters in the same area in Mozambique. And I think just reflecting on this, I think they've been dealt with fundamentally differently by the state. When a disaster is something that is isolated to one area, the state has mechanisms that kick in to then go and deal with that area and bring their resources. The difference with the pandemic is that it was national, it was global. So the state's normal response to a disaster couldn't be invoked. And therefore, when the ways in which the community responded when they needed support for disaster, their advocacy strategies, how they engaged with the state and others, was actually quite different to the ways in which they could respond and use advocacy strategies with the state in particular. It was the same with civil society and the broader residents, normal South Africans asking for help or philanthropy, but it was very different in terms of how they could engage with the state, because the state basically was far more absent in the pandemic in offering any kind of support as though there was a disaster. So I just think that's interesting. To me, this question raised that thought in my mind, and I thought, what is the difference between a pandemic as disaster and a climate issue, a flood, a fire, etc.?
Thank you very much, Fiona. We still have a couple of minutes. Is there any other question?
I think
no one has a question. Oh, no, sorry.
Go ahead, Fiona, because I think I'm raising your points in the chat. I think you mentioned something that you're asking about, India and Nepal.
Yeah, I was just very curious to know, Swati, around your cases. Okay, so maybe I'm putting political science hat on here, but what was were there any political dynamics around? Was the pandemic used for political leverage? Did political parties try to get involved? I was just curious, because you didn't discuss it obviously in your presentation, understandably, but I'm just really interested to know, was it ever leveraged, and what was the broader political economy around what was happening there, or is it kept external?
So COVID actually became a huge political point in the ongoing elections and the state elections, and in India we right now have a very right-wing government. When COVID pandemic first struck, the elections were going on. There was a lot of criticism from the opposition as well as other civil society groups that the election campaign kept going on. There were massive rallies, there were events, there were functions, no social protocols were observed. There was a huge politicization around introduction of vaccines, including India's sort of misplaced idea about having vaccines which are just nationally produced and not importing vaccines, to an extent that India is completely try to rely on an indigenous vaccine program, Covaxin and Covishield, not allowing other vaccines to come in. This became problematic because there was an acute vaccine shortage. There was also India was extremely badly hit during the second wave of COVID. which led to a lot of criticism of the ruling party. There were visuals of migrants carrying their children on their backs, traveling hundreds of kilometers, thousands of kilometers, going back. There were visuals of bodies floating in the rivers, hundreds of bodies floating in the rivers. And at the same time, election campaigns were going on. There was a massive sort of a event organized at one of the religious places in India for the construction of a temple. And this was all overlooked by media. Unfortunately, a lot of criticism which came in did come in from civil societies, from the NGOs, from the opposition parties, from media which is not mainstream, from social media. It did become sort of an election issue, but it did not really impact for some reason the election results for the ruling party, the results went in favor. And in fact, India, I don't know, has been positioning itself as a leader for managing the COVID crisis. For some reason, the Prime Minister's photo is on the COVID vaccine certificates. India has declared itself to have defeated COVID several times, even though the testing has been fraudulent. The numbers that have come in of the number of deaths has been, it is not being matched. The international agencies are saying that the numbers might be as high as 10 times what has been reported by the government. So there has been a lot of politicization around vaccines, deaths, management. Still, it is going on about arbitrary rules, about conflict between state and the center. So yes, COVID has emerged as and especially the NGOs have been the point where the government has faced some resistance, NGOs counting as civil society. So NGOs have played an important role, not to a very large extent, because they could not for some reason come together because they were working in very local context. But yes, so does that sort of answer your question?
Thank you very much, Swati, and thank you very much, Fiona, for your question. I think your question was also for Nimes. Nimes, can you reply to Fiona's question with regard to the state and role and the political economy background in 1 minute, and then we need.
Oh yes, sure. I guess we know that that's what you mentioned about the sort of the right-wing government in India, but we at the time of the pandemic. At the sort of the pandemic 2.0, we also had a government which was very much like eccentric, basically the prime minister making claims about how migrants are sort of vectors of the disease and everything. So that actually posed a further challenge to the well-being of migrants. So it was very timely for civil society organizations to kind of basically sort of galvanize and kind of come up with other kind of efforts in favor of the labor migrants. So I think in Nepal and India's case, it's also one of the complexity in our project right now is that Nepal has a lot of international labor migrants going to Middle East and Southeast Asian countries, but we also have over 1,800 kilometer open border with India. So we also have cross-border migrants, right? So those are often undocumented. And so it is really a challenge and sort of how to organize these migrant communities like under different themes. So there are also different category of migrants as we speak. We obviously we are not able to cover in our research, but that's also an interesting question to look at in thinking about pandemic. But yeah, it's definitely made complicated by other geopolitical issues between Nepal and India.
Thank you very much, Nimes, and thank you very much, Melanie. Also, Melanie, for the questions that you posted in the chat. I've copied and pasted them in my notes, and I hope there will be another opportunity to discuss them and to explore more in depth your research. And thank you very much. 40 minutes are not enough. This is the feedback that we will give to the organizer, because even if we look at the presentation in advance, etc., the time is really, really tight.
Even with one person dropping out, right?
Yeah, exactly. Is but it has been extremely interesting for me to watch your presentation, to learn a bit more about your research. And I hope there will be other opportunities, including the NGOs, including the book proposal that we would like to share with you. I'm posting in the chat the address of the mailing list of the NGOs in Development Study Group, if you would like to join it and be update on the initiatives that we organize. That would be great. Ibrahim, would you like to add anything?
I would like, to thank you for chairing this panel and thank all the panelists, all contributions, questions, very interesting. I personally learned a lot from different experiences, that from Nepal, India, South Africa, Colombia, all of these things, sharing the same, let's say, values, the same challenges, the same approaches to some extent, in responding to the disaster of the pandemic. So I'm quoting here, Nimish, the disaster itself. So the pandemic, I agree with you, Fiona, it's a disaster and all it means. So I don't want to take more time from your time as well and the panel, because I think we are closing. We are looking forward for your contribution. Stay in touch. If you have any idea you want to publish, we are open. We have actually, let's say, common ground values, as well as we have a great space to accommodate the ideas, the concepts, responding to the panel, to the pandemic, as well as the contribution of the civil society. You have great ideas, great experiences from the field, and looking forward actually to engage with you more and more in actually publishing your work, as well as to hearing to your contribution in our future webinars. And my pleasure meeting you, and hopefully next year we can meet in person. Thank you all.
Thank you very much also to the participants. Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye. Okay.
Bye.
Thank you. Have a great day, guys. Thank you.